So the advice to you is, if you are a smoker, stop smoking right away. If you are not a smoker, don't ever think of picking up the smoking. Another thing is obesity. And obesity is another problem now. We even put obesity is one of the chronic diseases, because obesity can link to the high blood pressure, diabetes, heart disease, and even including cancer. Now we are talking about that. So how do you know whether you are obese or not? I think all of you know how to calculate the BMI. It's a weight in kilogram divided by height in meter square. So if your BMI is between 18.5 to 22.9, you are very healthy. I don't really see many obese in this room. Okay, then I think all of us, we always advocate that must do physical activity. I do not know how many of you in this room are doing regular exercise. Including me, I don't do regular exercise. Okay, nutritional factors, which I think is everyone is talking about this cancer and nutrition, cancer and diet. So we see what are the things. I think all of us, we know what are the healthy diet, but it's very difficult to practice. We don't like to eat all these kind of good advice that we are supposed to follow. I think this is a food pyramid that every one of us, we know. Try to eat as much as you can for the base of the pyramid, and then try to eat less, at least on the top of the pyramid. Okay, what are the risky diets? We always talk about risky diets: high fat, high calorie, red meats, and alcohol. These are some cancers that you can link with the high fat diet, high calorie diet, and then red meat and the alcohol. If you are the alcoholics and if you smoke, your chances of having these mouth cancer, larynx, liver cancers are much higher. Another kind of food is a salty diet. Try not to add extra unnecessary salty diet, and then char food, which is barbecue. This will be associated with the cancer of the nose, esophagus, and the stomach. And nitrate and nitrites, but like what we always used to say, that thanks to the fridge nowadays. Last time we don't have fridge, so we have to preserve food. And our grandparents' time, they use a lot of salts, a lot of nitrites to preserve food, so that the food can last longer and we can eat. So these are now associated with the cancer of the nose and the stomach. Bitter nut. In India, I think the mouth cancer is very common because they like to chew the bitter nuts, and this chronic irritation of the mouth can cause cancer of the mouth. And aflatoxin, which is the one that I have mentioned it to you before, which we can find it in the moldy food. What are the safe diets? High fiber, and then high content of fruits, vegetables, and cruciferous vegetables that everyone is talking about: cauliflower, cabbage, and broccoli, and then soybeans. These are the very safe diets. So we should eat more vegetables and try to cook in the way of steaming, boiling, and then grilling instead of deep fry. And then avoid all these, bak-kwan, all the deep fried food, and the barbecue. You can eat barbecue, but not every day. And these are the moldy food that I have mentioned it to you before. If you are the alcoholics, you like to drink, try to keep maximum 1 cup a day, not more than that. And in Singapore, water is very precious. So try to drink water at least 8 cups a day. So by doing so, you can reduce the cancer-causing substance and increase the protective factors in our diet. So now we talk about antioxidants. There are some people, they believe that taking antioxidants can prevent the cancers or whatever. So what are the things that we talk about? Fruits rich in vitamin C, vitamin E like olive oil, beta-carotene, and the selenium, which is rich in there. We can find a lot in the nuts. Another thing is stress. Everyone always like to ask, is stress causative factor of cancer? Does stress can cause cancer? There is no evidence and no proven data that stress can cause cancer. But one thing for sure we can say is, if you are stressed, your body immune system is low, and then your chances of having all kinds of infections, flu and all those cancer patients, if you are stressed, your immune system is low, your chances of recurrence is also higher. Every one of us have stress. I don't believe nobody has no stress. Even the little baby, the child also has stress. If they don't get the milk in time, they also get stressed. But how we cope the stress, how we accept and how we adapt the stress, this is very important. And I have mentioned it to you, that there are some cancers which are linked to the sexual behavior, so avoid casual sex, be faithful to your spouse, and then use condoms. So these are the primary preventions that I have mentioned it to you. Now I go to the secondary prevention. What does secondary prevention mean? Secondary prevention means we can go for some screening, or we can detect there's some warning signs of cancer, or we can go surgery for some cancer preventions. Early detection means you can have the prompt treatment and then you can save your life. Screening is to detect the cancer even before the cancer develops in your body. And that stage, if you can get the very early stage, precancerous stage, like cervical cancer, which I mentioned it to you, you can be saved and you can be cured. That's why you need to go for regular checkup like pap smear for the ladies to prevent the cervical cancer, fecal occult blood test or colonoscopy for colorectal cancer, and physical breast examination and mammogram for the breast cancer. These are the confirmed screening tests that you can go for early screening and you can detect the early stages of the cancer. Screening means you must be able to offer the treatment or before you really get the cancer. That's why there are many cancers you cannot go for screening, because by the time you pick it up, that means you cannot offer the very early stage of the treatment. Okay, these where to go for screening. These are the confirmed tests that you can go for screening and you can pick it up the very early stage of the cancers. And FOBT, fecal occult blood test, and colonoscopy, you can go for. Our West Medical Group provide all the screening tests. Yeah, then you can do how often. Like FOBT test, you can go for annually, every year, once you reach at the age of 50. And colonoscopy, we recommend once in every 10 years if your test is normal. Those who have the family history, those who have some history of polyps, we will recommend to go on every 5 years. Pap smear test, also you can go for annually for first 2 or 3 times if it is normal, and you can go every 2 to 3 years once. Breast self-examination, no need to pay money, you can do yourself at home every month. And clinical breast examination is you go and see the doctors and the doctors will check for you every year. Mammograms, which I mentioned it to you, is if you are between 40 to 49 years old, go every year mammogram. If between 50 and above, you can go every 2 years once. Okay, these are some warning signs that I think all of us we should know. No? A sore which refuses to heal, what does it mean? Let's say you have an ulcer in your mouth. Usually the ulcer or the sore should heal within 2 weeks by your body own mechanisms or applying some cream and all these things. But if you have the ulcer or sore which refuses to heal for more than 2 to 3 weeks, this is not normal. You must go and see the doctor. And lump or thickening in the breast or as well, which I have mentioned it to you. If you feel any lump in your breast or any part of your body, yeah, you must go and see the doctor. But not all the lumps are cancer. I have mentioned it to you. Unusual bleeding or discharge, apart from the usual bleeding like menstrual blood, if you got bleeding from the other part of your body, unusual, you must go and see the doctors. Change in normal bowel habit. All of us, we have the normal bowel habit like every day or every once in 2 days time. But if you have changed your bowel habit, like suddenly you got constipation followed by diarrhea, or diarrhea followed by the constipation, then you should see the doctors. And all of us, we have mole, and this mole suddenly change in color or change in size or like suddenly itchy or bleeding or something like that, you must go and see the doctor. And persistent indigestion. We do have some indigestion, but persistently you are having indigestion or discomfort in your body, you must go and see the doctors. Difficulty in swallowing. Like last 2-3 months ago, I saw one young man. He's 18 years old, Singapore Polytechnic student. His only and one symptom is difficulty in swallowing. The mother did not believe that. Why you are having this difficulty in swallowing? He keeps saying, "Mother, I can't drink water, eat rice with soup," which delays for almost 6 months. And under such that he really cannot swallow, then they came to see the doctor. It's advanced stage 4 stomach cancer. It's very sad. And persistent hoarseness or cough. Sometimes we do cough, and the cough should go away within 2 to 3 weeks. If you are having persistently coughing for more than 3 weeks, you should go and see the doctor. We will recommend you to go for chest X-ray or unnecessary further tests. So I have mentioned it to you, all the prevention, primary prevention, secondary prevention. Prevention is better than cure. We should prevent before any disease developed, and this can save our life. Yeah? I think this is my slides. With this, then I would like to end my talk, and it's time for question and answer.